Irritable bowel syndrome, a unique holistic approach to the diagnosis and cure of IBS. IBS is a common disorder of the intestines that leads to cramping, pain, gassiness, bloating, and changes in the bowel habits. Some people with IBS have constipation while others have diarrhea, and some people have both. Some people experience IBS as cramping urge to move the bowels but can't do so. This is the NIH definition, which also says that doctors have been unable to find an organic cause for IBS. However, there is a cause of IBS, and it's called something named dysbiosis. Dysbiosis means the disrupted intestinal flora, and the symptoms are identical to those of IBS, the cramping and bloating, diarrhea, digestive distress, and so on, and also a feeling that things just aren't right in there. Food intolerances and a very limited diet are also often a part of the entire clinical picture. Dysbiosis occurs when the protective intestinal flora is damaged. The mucosal surface lining of a healthy intestinal tract is normally infected with 300 to 500 species of microbes, including Acidophilus, Bifidobacteria, and the E. coli species. The probiotic bacteria play the following roles: by preventing overgrowth of the pathogenic bad bacteria, reducing inflammation, upregulate the antibody production, assist in digestion, play a role in recycling hormones, protect and enhance immune function, strengthen intestinal mucosal barrier function, just to name a few. When the healthy flora are damaged, the bad bacteria colonize the intestinal mucosa. They in turn eat the food of the healthy flora, and these bacteria are often putrefactive and fermentive, which means that they create gas and foul-smelling bowel movements. The body tries to evacuate the bad bacteria by speeding up the gastric motility, and this in turn creates diarrhea. Because the intestinal contents of our body pose the largest threat from the outside, most of the immune cells in our body are positioned there to protect us from the toxins, bacteria, viruses, allergens, and other undesirable chemicals that can be found in the bowel contents. In other words, the immune system lives in the gut. Intestinal inflammation and infection damage the protective flora that occupy the mucosal surface of the intestinal tract. The good bugs are replaced by the bad, and the consequences are disastrous. The effect of the immune cell damage and the chronic inflammation is susceptibility to frequent and recurrent infections or ongoing bad bug dysbiotic infections, and these are mistaken for true IBS. A compromised mucosal surface allows toxic material and partially digested food molecules to gain entry into the bloodstream and the general circulation. This is called the leaky gut syndrome. Leaky gut sets the stage for systemic problems anywhere else in the body. These include systemic immune stress, liver toxic overload, allergic symptoms, food intolerances, autoimmune disorders such as arthritis, asthma, Hashimoto's, and so on, and many other symptoms. Holistic medicine in the West also treats IBS, but it's in its infancy. Every year there's a new book about diet and nutrition. Research often contradicts itself about vitamins and nutritional advice, and this is why, as a consumer, it's often confusing to get reliable and consistent information about holistic treatment of IBS or any other condition. Many holistic practitioners understand and treat the dysbiotic cause of IBS, and in this regard they are far ahead of the medical science in their approach, but unfortunately a little knowledge isn't always enough. Treatment of dysbiosis and the related IBS symptoms requires a deeper understanding of the physiology and therapeutics than Western holistic providers have. Therefore, after curing dysbiosis, it often comes back again in its full force. For this reason, I gave up the practice of Western holistic medicine and adopted a 5,000-year-old system of medicine from India called Ayurveda. Let's analyze what the ancient doctors of India tell us about dysbiosis and IBS. The ancient physicians knew that the gut is the gateway between the external and internal environment. They called the bacteria in the gut yoginis, and the word yoga, which means to connect together, is the root of that. This is exactly what the flora does, as it mediates the external and internal environments. For this reason they called the gut the brain of the brain. Another saying from Ayurveda is that wherever the clouds go, that's where it rains. That means that wherever toxins go in the body, they create dysfunction and disease. This is extremely important with the leaky gut aspect of dysbiosis, where the toxins are allowed to cross the mucosal barrier and enter into the bloodstream. Sangrahi means an alternating diarrhea and constipation. The ancient doctors tell us that this symptom marks a more serious progression of IBS. The intestinal wall at this point is impacted with old residue, and care must be given to slowly clean and restore intelligence to the delicate intestinal lining. After chronic dysbiosis sets in, the liver becomes overwhelmed with the toxic load. Its ability to function intelligently, that means what to filter and what to allow into the bloodstream, is compromised. The liver becomes dumb or tired, and this allows reactive toxins to circulate throughout the body. This sets the stage for many other diseases. When treating dysbiosis and IBS, the ancient doctors tell us that the toxic liver becomes a major concern. Without an intelligent liver, digestion will never recover. A liver overloaded with toxins can dump the acidic toxins back into the gut, and this in turn wipes out the flora again. In general, our treatment approach will replenish and restore the normal flora of the gut, repair and restore the intelligent functioning of the intestine, repair and restore the intelligence of the body's channels of absorption, delivery, and elimination, restore the intelligence of the liver, and detoxify the body. This approach takes time, healing the damaged tissues and re-enlivening normal functioning after perhaps decades of dysfunction does not happen overnight. Our testing begins with an ancient approach of pulse diagnosis. Ayurvedic pulse diagnosis allows us to glimpse the subtle imbalances in the physiology, the toxic load, and the tissue derangement caused by toxins. I also use a chiropractic technique of reading the body through muscle testing called applied kinesiology. This allows me to test for dysbiosis, heavy metal toxicity, and parasitic infections. Our treatment includes nutritional modification, which is using food as medicine, behavioral modification, the body's natural rhythms of sleep, digestion, elimination, and hormonal regulation must be brought back into balance. Oral herbal remedies, ancient Ayurvedic herbs are used, and there are no heavy metals in our products. Transdermal herbal creams, when the gut is dysfunctional, we often use herbs transdermally to improve absorption, and herbal glycerides are herbal formulas in a vegetable syrup that can be added to water and sipped during the day. Again, my name is Dr. Doug Beech, and I have been practicing Ayurveda and chiropractic for over 25 years. And for more information, you can contact me at this phone number. The best way to contact me is by my email, docbeech@gmail.com, and you can also go to our website at drdugbeech.com. Thank you for watching this presentation.